Types of donation. Donation can be broadly classified into two: deceased donation and living donation. The deceased donation can be further subdivided into donation after brainstem death or DBD, donation after circulatory death or DCD, or tissue donation. In this video, we will explore the different types of donation and the criteria for each type. Donation after brainstem death. Donation after brainstem death is possible from patients whose death has been confirmed using neurological criteria. Donation after brain death, also called heart-beating donation, therefore refers to organ donation from heart-beating donors for transplantation purposes in a well-controlled circumstances following a diagnosis and confirmation of death using neurological criteria. The organ quality following DBD remains superior. That means there will be less need for dialysis and few biliary complications for the recipient. A donor who is declared brainstem dead will be able to donate his or her kidneys, liver, pancreas, lungs, heart, small intestine, depending on the organ suitability and function. Donation after circulatory death. Donation after circulatory death, previously referred to as donation after cardiac death or non-heart beating donation, refers to retrieval of organs for the purpose of transplantation from patients whose death is diagnosed and confirmed using cardiorespiratory criteria. There are two principal types of DCD: controlled and uncontrolled. Uncontrolled DCD refers to organ retrieval after cardiac arrest that is unexpected and from which the patient cannot or should not be resuscitated. In contrast, controlled DCD takes place after death, which follows the planned withdrawal of life-sustaining treatments that have been considered to be of no overall benefit to the critically ill patient on ITU or in the emergency department. Who is the potential DCD patient? A mechanically ventilated patient with devastating brain injury, where the decision has been made to withdrawal of life-sustaining treatment. The expectation that the circulation will cease imminently upon withdrawal of life-sustaining treatment. A DCD donor will be able to donate his or her kidneys, liver, pancreas, lungs, and heart for transplantation. The DCD donation has increased substantially over the last decade, from 200 donors in 2007-8 to 584 last year, representing 41% of all deceased organ donors in the UK this year. Tissue donation. Tissue donation and transplantation has a dramatic effect on a patient's quality of life and occurs on a somewhat larger scale than organ transplantation. In the UK, there are over 450 multi-tissue donors and 2,500 eye donors every year, resulting in many thousands of transplants. Some types of transplants, such as cornea and heart valve transplantation, have been established for many decades and are reasonably well understood by health professionals. Other types of tissue donation, such as bone, skin, tendons, etc., are much less well known but will result in occasionally life-saving treatments for patients. Unlike organ donation, tissue can be retrieved many hours after death has taken place, meaning that the potential pool of tissue donors is far greater than that of solid organ donors. However, the selection criteria for eye and tissue donors are much more stringent because of the rather difficult balance between the benefits and risk of tissue grafting when compared with organ transplantation. Living donation. A living kidney donor is a person who gives one of their healthy kidneys to someone with kidney failure who needs a transplant. This could be a friend or a family member or someone they do not already know. As a living donor, you can also donate part of your liver for transplantation. In the UK, living kidney transplants has been performed since 1960, and currently around 1100 such operations are performed each year, with a very high success rate. A successful transplant from a living donor is the best treatment option available for most people with kidney disease. Generally, people who receive kidney from a living donor live for longer than who receive one from a deceased donor. Living kidney donation allows the operation to be planned at a time that is convenient for the recipient, donor, and the clinical team. Living donor liver transplants have now become an important part of many liver transplantation programs around the world. While adult-to-adult living donor liver transplantation remains a transplant procedure of choice in most Asian countries due to the lack of deceased donors in these areas, this is less commonly undertaken in Western countries because of the greater availability of deceased donors. This is especially true for the UK, following a recent increase in the deceased donor pool. Living donor liver transplantation now accounts for 7% of the liver transplants performed per year in the UK, majority of which are performed in 3 liver transplant centers.